today, Dr. HIMANSHU MATALIA, sir. He would be speaking to us on the clinics, what they entail.
Thank you. At the outset, I would like to say sorry that I'm not here to teach any trainer. I mean, it cannot be, it would be very unfair on my part to speak anything like that. I'm just going to put few points which I thought are important. And if somebody wants to start a fellowship where how we can start, I do not have any financial disclosure here. First, we need to ask the question that do you have it in you? Are you a teacher? Do you have all the qualities required for a teacher? And if the answer comes inside yes, then yeah, you right there to go ahead and start the fellowship. A lot of time people ask that what is the right time to start a fellowship? And especially when you are trained in a specialty, this question does come into mind that when can I start a fellowship? The answer is yesterday. You know what, there are so many students who need fellowship training, who need subspecialty training, and they're not able to go to bigger institutes, and they are around you and they still need training. The problem is we compare our training program and ourselves with our alma mater or the places we are trained from, and then we belittle ourselves. But let's not worry about that. Let's see that if we can make change and impart knowledge in one person's life, that's good enough, and go ahead and just start the training. Few of my friends, I insisted on that, and when I talked to them later on, they said that was possibly the best decision they took. Any fellowship program starts with this message: congratulations, you have been selected for the fellowship, and that's the best message of your academic career. The question arises, how do we decide as a teacher's curriculum of this thing? Well, there are ways and means of designing curriculum. There are some curriculums which are out there and people have designed, but the basic framework is like this thing. First, ask the question to yourself, goals. What are the goals of your fellowship? Then comes the statement of objective, or what do you want that person to be good at when they finish that program. That includes the technical skill, and that includes the non-technical skill part of also. And then the most elaborate part which we spend time on, which is possibly the easiest part, that's the course syllabus or curriculum. Then the teaching methods or objectives or lectures, and then the participation of the person in different programs, whether journal clubs, seminars, case presentation, CMC, CPC. You can collaborate with your microbiologists far across the globe because of now Zoom. You can possibly have microbiologists sitting somewhere else, and you can still have CMC and CPC there. Make sure that they have presentations in local conference, national conference, international conference, and finally monitor their teaching or their learning, whatever they are doing. Coming to the curriculum, which we normally give a lot of importance to, and which I feel we all know about it. But if we look at our subset or Indian subcontinent region, infection is something which you must make sure that person is very good at. Followed by ocular surface. Ocular surface is something which we consider as a subspecialty or super specialty, but unfortunately that's something which they'll come across much common than any other specific thing which we are taught in our fellowships. Ectasia is a field which sort of crossovers between refractive surgery and the cornea, and hence they should be good at ectasia also. The corneal transplant, of course, cornea fellowship cannot be complete with the knowledge of corneal transplant and different type of corneal transplant which we now go through. Similarly, the eye banking is very, very under stressed upon during the fellowship, and which is extremely important. They realize the importance after passing out, and hence knowledge of that would be very important. Ocular immunology is something which certainly puts a cornea surgeon a step ahead of other people, and they must have knowledge about ocular immunology. Similar in refractive surgery, they should be good at laser-based and non-laser-based, lens-based refractive surgery. They work up in everything, whatever comes around. Along with that, a contact lens training has to be there part of the curriculum. So the curriculum, which is possibly the simplest part of this thing, can be changed based on what are you comfortable at and what possibly is best at your place. Something which we seldom stress upon, but that's something called non-technical skill. Along with the technical skill, now across the globe, there are plenty of publications which shows the importance of non-technical skill, or NTS, where we talk about communication, leadership, we talk about teamwork, and finally, empathy. Without training on these things, the training of a student is never ever complete. Communication part, well, first and foremost, we go across for the fellowship in different zone of our country, different part of our country with different language, but we still would be resistant to learn the local language. We must learn local language wherever we go. And similarly, when we talk about the communication, very important part of communication as a student comes where introducing themselves. Again, there are a lot of publication on such kind of thing. Importance of introducing yourself to a doctor. I remember when I was a fellow, my consultant, Dr. Murli Krishnamachari, he would enter the room and say, Naam Peru Murli Krishnamachari, and he would like floor the patient. And I said, wow, this is so good. And as a fellow, I would start doing that, and patient would think that this guy is something important, and then possibly would give me better history and would allow me examination. And there was nothing wrong there, introducing myself. Introducing yourself as a doctor is very, very important part for the patient. The communication skill also includes the counseling. Patient counseling is something, it's an art, we all know. And each one of us has this uncanny thing where we can possibly convince the patient with those punchlines and those things. As a student, we must keep our eyes and ears open and learn these kind of things. It's a very important part of communication. Sometimes we can also learn what not to learn from a person also. That's a part of the training program. When we talk about counseling, we also should know that the base of the counseling is your subject knowledge, and you must know your subject knowledge thoroughly. There's no point thinking of any bullshitting around, because patient can see. If patient can learn from internet, well, so can you. So there's no need to unnecessarily feel sorry about yourself when they read from internet. Well, you can do same thing. The next part is leadership. Now remember, a difference between a boss and a leader is boss says, go, and leader says, let's go. The leadership is not a position. Leadership is an action. Many of you would have seen this advertisement where that small boy is trying to move the big tree, and all it needs is just first action, and then the wheel moves on, and then the things happen and the magic happens. So leadership, whenever we talk about, it's not always required to teach them leadership by taking lectures or something. Leadership is taught by doing the actions, and that's what leaders are made up of. Next is the teamwork. Well, teamwork is possibly a little easier. Well, that include the fellow in your gang from day one. Take them out and bosses should take them out for parties, and especially maybe IPL final or World Cup final, and all those things are not a bad idea. Secret Santa is another thing which I recently learned, that this is another super fun thing. A new person would still open up because they don't know who's getting the gift and whom they are giving gift to. So Secret Santa is another one which sort of helps you. Then last part is empathy part. Now empathy part, we all know that whenever we become doctor, we always ask the question, what kind of doctor you want to be? Do you want to be a scary doctor, or you want to be a kind doctor? And of course, the answer is we all want to be a kind doctor. And sometimes a gentle touch is more than enough than any medical treatment. But please remember, empathy, when we talk about patients only. But why just show empathy to patient, and why not to your student? Many times it does happen that we are actually split personalities. We are so good at patient and so good at our peers and so good at our friends, but we are quite shitty with our fellows or students, which is not right. I mean, that's not. If power, I strongly believe, if power, position, and money changes you as a person, you were never that person. So many times the person was very sweet and as a student something, and later on becomes really a don. That guy was always a don. So, and also remember, karma is a bitch. Karma strikes back. So whatever you do, however you treat people, they always remember that whatever you taught, nobody is going to remember that, and they may not remember. Finally, a message for the trainees that, well, this is the time to read. Read as much as you can. You can learn from books, journals, recorded webinars, which are plenty out there, and be like a sponge. Absorb everything, whatever your consultant does, whatever, make a note every day, how he holds or she holds the instrument, make a note of that. And finally, be the best version of yourself. You can't be a good cornea surgeon or refractive surgeon if you're not a good doctor, and you cannot be a good doctor if you're not a good human being. Thank you very much.
Excellent. That was a superb lecture. And actually, I would really confess that even during our training years, soft skills is something which was really not conveyed, and we all just learnt along the way. So I think this is really so important, and I'm sure all our latest generation kids would be so lucky to be having such good trainers now. Thank you so much. Any comments, Dr. Sri Ganesh?
I think the fellowship programs have changed quite a bit now, because previously you just wanted to train with somebody. You looked up to somebody, and then you wanted to be like them. You wanted to be a person like them. You wanted to be a surgeon like them, and then, that's how I started my fellowship. In fact, I started my fellowship when I was probably 5 years into practice, and then one of my first fellow, Kishore Krishna, he came and he asked, I want to watch you do surgery. Then he came and watched me do surgery. Then he said, I want to join as a fellow. I said, but I don't have a fellowship program. He said, no, I just want to come and train with you. And that's how he joined. But now, more than, training with one particular doctor, it's like, okay, I did my fellowship in this institution. Because there is a whole syllabus, it's very well structured, and then I think a lot has changed.
More complete.
Yeah,
yes.
But I think both have different flavors. And I think in the US, even now, it's like they say, I did my fellowship under this person. Like my sister says, I did my fellowship under Shelby, because everybody knows him as a person, and then they expect the fellow to be like the mentor. And that's how it is. But I think there is a changing trend towards a more structured syllabus where you do X number of surgeries, and the mentor doesn't really matter that much. But I still think that the mentor has a very large role to play in a mentee's life.
In the MOS, the Maharashtra Ophthalmological Society, Dr. Jignesh Taswala, who is the present president, they have started the mentor-mentee program. It just kick-started last week. So,
I think every member in this audience is a teacher here, and I think I'm closer to a student than anyone else here. So I'll ask a question to Dr. HIMANSHU and the expert panel from a student's point of view. Generally, especially since the topic is on cornea and anterior segment, what most postgraduates who finish and are waiting to enter a fellowship, when they ask each other, peers, seniors, the questions they ask is really about how many phaco's will I get, how many PKs will I get, how many LASIK will I get. It's not really the things which you spoke about, and frankly, that's what we learn more during the fellowship than the surgical training itself. So what do you feel, sir? How would you guide a student or anyone in the expert panel on what aspects they should look into? What should they ask their seniors when they are choosing a location for a fellowship?
So I think, in fact, I had same discussion last week with my fellow who is down almost a year now. So I think it's a mindset, and not only just that, the communication channels between teachers and students are still not as open. Why should they ask a senior who is possibly, again, as bad student and as naive as that person, rather than there should be way to ask that teachers. There should be communication to learn. So what they want to learn, that itself is not very clear in many of their minds. And the worst thing is that's not how they ask. It's like, how much cutting do you get? That's like typical maybe Bombay language, right? Cutting, how much cutting?
You should tell them to go to a barber shop.
True. And in fact, it's like my fellow first day said, I'll dispose the patient, you can carry on with it. I said, you do not dispose human beings, right? That's the mindset sometimes we have, dispose patient and cutting. Well, we need to change that mindset. We need to possibly show them that what they get in their life, being with some people, being in a system, as Dr. Shri Ganesh said, is much more than a few cases here and there.
I got to hear a lot of all this. My son just joined LVP as a DNB resident, so all this is really, what he says is so true.
I just say one thing.
This is a common question. When they ask me how many surgeries will I get, I tell them it depends upon you.
Yes, absolutely. I think that's the best answer you can give them.
mean, a lot of people, they say that how much cutting do you get? I give them my example that at RP Center, when I did my PG, we did 1 cataract a month. And at LVP, when I did my fellowship, somehow I managed to do only less than 10 keratoplasties. And I don't think as a surgeon I'm anything bad than what the others are. So I think it's not the number of surgeries, but it's
The
what you
quality,
see in
yes.
the, the consultant doing surgeries and how much you can pick up from that. I think the fellows or these PGs, they have a feeling that if I do 100, I'm a boss. And if I do 10, I'm nowhere. So I think that concept has to totally change, it's how you do it and not how much
And
you
they
do.
have to be like a sponge. They have to pick
Yeah.
up things from.
The quantity
No, sir,
is not important at all.
that's why my question was around that, in the sense that everybody asks about numbers. So, what do you feel a postgraduate should be asking when they decide where they want to do a fellowship as per their interest and other things? Sir?
I mean, the question basically is, whenever you are finishing your MS, you're investing another 2 years of your life. You want to finish that and you want to start your private practice, or you want to join. When you join, every institute asks you how many cases, because even when we take an interview for somebody who's joining, we ask your CV, how many cataracts you have done, how many PKs you have done, how many DSECs you have done, can you do a DMEC? Not everybody going in out of fellowship is going to be competent. There is going to be a learning curve for all of us, even once we join as a fellowship. But what is important is, have you understood the basics of the specialty? Are you managing the patients appropriately? Every surgeon goes through a learning phase. Even that fellow who finishes his fellowship has to go through a learning phase. There is going to be a basic minimum number for you to get competent, which is there, which could be 5 for somebody else, it could be 50 for somebody else, which varies from individual to individual. But I don't think we'll be able to put a fixed number for everybody to say, okay, you're going to be competent in this number of cases. But even if you do few cases, but if you do it in a proper methodical manner, you actually come out much better as compared to doing 100 cases without supervisions and learning the wrong thing. Because unlearning something which you have learned is more difficult than learning in a correct manner. The second thing that I would probably want to emphasize is, you learn more from watching surgeons struggle than you learn from watching an expert surgeon. You see a phaco surgery being done by the best surgeon. You feel it's such a simple procedure. 5 minutes surgery is done. You see your senior colleague operating, then every step can have a problem. Your incision can have a problem. Your excess can have a problem. So you learn. I tell all my fellows, you will go for all the therapeutics or all the surgeries that your senior residents or your senior fellows do. You will learn more by seeing them struggle, because once you see them struggle, you come back to the consultants who are, and you see what is different that the consultant is doing as compared to the fellow. Or you will be asking questions as to why he struggled and why you didn't struggle.
So
How about just asking, I mean, are we just sent to camps, collect surgeries, and then, keep on doing them during our fellowship? Or is there some supervision where, you are, like I was hearing Dr. Sirisha talk, I mean, where your hand is held and you're made to do surgery. So maybe it requires, 10 surgeries, and one student spends those 10 surgeries on just, how to make a tunnel, for example, or how to do lamellar dissection. So they have spent 10 eyes, but this is the only step they have learned. So it maybe with 100 also you may just reach up
I
to
think
the
it's an
Rexes.
ongoing process. Even after 100, you may not really be so competent.
Supervision, I think, is
Yeah, I think that point comes when you get that confidence and you start learning yourself. Today, even YouTube channels, there is such good surgeries that are seen. I mean, it all depends on where you pick up what
I just have
step.
one additional point from what Dr. Bhaskar said. I keep telling my postgraduates as well as fellows, you do wet lab practice every day, even if you've become good at doing SICS. Because once I heard Dr. Tan, from Singapore, he said he does wet lab practice even today, after doing so many surgeries, because I personally follow that. So for every surgery, I was when I finished my PG, I was an ICC surgeon. So I've come a long way. I mean, I'm sure most of my people in this age group, we've done ICC, we've migrated to ECC, then phaco, then PK. PK, nobody was my mentor. What I just seen as a postgraduate, I started PK, DSEC, DMEC. So everything, you can do it. Like you said, there are so many YouTube videos, there's so many ways to learn, but the best way to learn is do wet lab practice, because you cannot sacrifice a human eye for that.
Absolutely. Yes, Dr. Harshardhan.
Yeah, good
If you
afternoon.
could set it up, the
Yeah,
next
yeah,
speaker.
talk.
Yeah, good afternoon. I think fellowship is an ongoing process that you rightly mentioned. It's basically starts with your structured fellowship in a particular institute or under a particular doctor. or a professor, and after that it continues in your own institute where you are working with another senior doctor who is doing certain things which you are following and picking up, and then it works furthermore through your own practice. As you start learning from your mistakes, you start analyzing and auditing your mistakes. When you go home, see your videos again, and lastly it also comes from all other doctors around the world through, as you said, YouTube channel. I can be a fellow of Dr. Basak even staying at home. So that's how today it should evolve, and we should not label somebody as you are a fellow of LV and oh you're from this institute. I have known people who have worked for 3 months under some doctors and they have become big faculties in their own fields.
We can all
Just
be
by-
Ekalavyas of
Just by 3 months of fellowships, they can learn. They learned many more things after that. So that's
so true.
that's what I.
I think to answer the question, what should a trainee be asking? See, I think observation is the first step to learning. So you observe and then monkey see, monkey do. So if you observe a bad surgeon, you'll pick up all the bad habits and then it becomes very difficult to change that. If you're observing a good surgeon operate, then you learn the principles, you learn the techniques properly. So the first question a trainee should ask is, will I have opportunity to observe the surgeon? Because some places it's so busy that the fellows are so busy doing camp work, other work and all that, they don't get to observe good surgeries. And then they're just given surgeries to do. They are not observed surgeries, so how can they, practice? So that is one thing. That's the first thing, whether they can observe good surgeons at work. Second is whether they have access to resources, like wet labs. That's very important because they will have to practice on. The third is whether the training will be supervised. Many of the big institutes, there's no supervision. They just give you the case and say, do it. And the trainee does whatever he wants, and whether he's messing up, whether he's doing something wrong, there's no supervision. So third is whether I will be supervised. That is another thing which has to be, and whether there's somebody to correct me. If I'm doing something wrong, is there somebody to correct me, correct my steps? It is so important because small things you tell them, it makes a big difference to the surgery, it makes a big difference to the confidence. So more than the number of cases they do. Number of cases probably is the last thing that they have to look at.